Hi friends, my name is Dr. Bikash Rai, and today I'll be talking about some lifestyle changes following open heart surgery, such as bypass surgery. So this is my first Facebook Live, so I may make some mistakes. So please pardon me for that. And if you have any queries on any of the topics that I would be mentioning it, kindly please text me or you can send the messages here. I'll try to answer those questions. Don't hesitate. So bypass surgery is done in a condition called coronary artery disease of the heart, and this disease is very common in India, not only in India but in the world. And before I talk about bypass surgery a little bit, let me tell you that heart is nothing but a pump. Just like our water pump at our homes, this heart is God's such a creation that it pumps blood to all parts of the body, and for our body to survive, it requires blood. So blood has to go to each and every organ of the body, every part of the body, and this blood is supplied by the heart. It keeps on pumping even since even before the time of birth of the person. So when the mother even doesn't know that she is pregnant with a child, at the 4 weeks of intrauterine life, fourth week, heart is formed and it starts beating, and it will beat till the time the person is dead. So it's such a pump that nobody has been able to create such a pump. No engineer has been able to create such a pump, and this pump supplies blood to all parts of the body, and for our body parts to live, they require blood, which is supplied by the heart. Now, for any pump to run, you have to give some kind of an energy. Say for your water pump, you'll give electricity, or say for any pump, you have to give, say, petrol, diesel, like that, and then the pump will run. For heart, it requires blood. So it pumps blood, but it also requires blood to run itself. So heart is only composed of muscles. They are called smooth muscles. They are very fine category of muscles which keep on pumping blood incessantly, and they require blood supply for their survival. Now, blood is supplied to the heart by 3 blood pipes. We call them coronary arteries. And these blood pipes, they have some branches also, but there are 3 major blood pipes. And they supply blood to the muscles of the heart, and therefore the heart keeps on pumping. Now, because of some problems, like say coronary artery disease, the cholesterol is deposited inside those blood pipes, and the blood pipes become narrower. So the heart muscles, they do not get adequate blood supply, and therefore there may be problems. So usually the patient complains of chest pain. The pain usually occurs in the left side of the heart, and the pain can go to the shoulder and to the neck also, nape of the neck, back of the neck, and to the hand also, even to the fingers also sometimes. And sometimes the pain may occur on the right side also. So any person who is more than, say, 35 years of age and complaining of chest pain, especially on exertion, or especially, say, doing some kind of works or physical activities, if that person complains of pain, then he should always consult a doctor, so that we can find out that this is not because of any heart problems, but because of something else. So any chest pain should be taken seriously. We should not treat it by over-the-counter medicines like gastritis medicines or such kind of medicines. We should always consult a doctor, and we can easily diagnose a problem of heart by doing some tests like ECG test, echocardiography, or coronary angiography. Now, if the blood pipes are blocked, say, to a minor degree, then medicine can be prescribed, and the patient will be taking these medicines for lifelong, so that this blockage doesn't increase in size. Now, if the blockage is much more, or say it is confined to only one artery, then sometimes without even operation, we can open up the block. It is called angioplasty. So we put a small pipe, we call it catheter, and this pipe goes to the blockage area, and when it reaches the blockage area, then we inflate the balloon. At the end of the pipe, there is a balloon, and we inflate the balloon, and thereby we destroy the plaque or we enlarge the artery. And so that the artery doesn't become blocked again, we leave a stent or a medicated spring-like substance so that the artery doesn't become blocked again. So this is called angioplasty. And if the blockage is much more, say it is present in all the 3 arteries, or it is present in the left main artery, or the blockage is 90% or 100%, then this angioplasty cannot be done, and bypass surgery is the only way for that patient. And bypass surgery is a very good operation. It is the most commonly performed operations by a cardiac surgeon, and it is well established and well studied operation, and it gives prolonged life to the patient. So if the patient is suffering from multivessel disease, and the bypass operation is the best choice, and it will prolong his life, it will decrease his rehospitalization rates, and there are many other benefits also. So it is a commonly performed operations. Many of you or your relatives might have undergone this operation, and people have many queries, like after the operation, what to do, what not to do. So I'll be delving little on that. So it is not that bypass operation means it is the end of the story. It is not like that. Even after operation, bypass surgery, a person can live happily ever after. So no problem, nothing at all. If the patient doesn't tell to somebody that I have undergone this bypass surgery, nobody will in fact come to know about it. So you can live a completely healthy, normal life. So no doubts about that. So don't worry if somebody has to undergo this operation or somebody's relatives have to undergo this operation. Although it's a major operation, major open heart surgery, but it is as safe as it can get. And with technological advancements, this operation has become very, very safe. Now, after the operation, the first query that I get is like whether to do exercise or not, or when to start the exercise. So this is a very valid question. Please remember that after the operation, you have to exercise the heart also. So the best way to exercise the heart is probably kind of walking with a speed. We call it jogging or speed walking. So that is a very good exercise, but you should not start immediately after the operation. You should give a little bit of time, say around 1 week of time before you really start the exercise. So you do not immediately go for say 30 minutes or 45 minutes. You start it with say 5 to 10 minutes. You space it say 4 times or 5 times like that. Then gradually you increase the duration of time and you decrease the number of time. Say after 2-3 days, increase the time to say 30 minutes, say twice a day. Then after say 2 weeks or 3 weeks, then you can increase up to 45 minutes or so, and then you can do it once a day. So initially you start it inside your home, inside your household and all, or in the neighborhood, or inside the building compound and all. So don't go outside, and under observation you do the walking and all. So the first step for walking to start the walking exercise is to you climb staircases. So you say climb staircases, 1 flight of staircases, then 2 flights of staircases. Then you start walking in the neighborhood or in your compound. So exercise should be done. This walking is a very good exercise, and you increase the timing gradually and you take it slow. So that is the rule for exercise. Then the next query most people they ask about is about the food. So food habits, and they have many queries. Sometimes they call us, the doctors, at the middle of the night. Maybe the patient is like on the dinner table and he wants to take something and he has this query whether to eat it or not. So they call up. So it's a very common query. So for food, if you do not have diabetes or do not have hypertension or high blood pressure, then you can eat any kind of foods except fatty foods or say high carbohydrate foods. So you take balanced diet. We call it balanced diet. So you take protein, carbohydrate, and fats in equal portions. So maybe the carbohydrates, you say you take say 1/3 of the total portions, then protein 1/3 and fat 1/3. So you can take it like that, a balanced diet. Do not take too much of salt, and so salt is not good for your heart, so you should decrease the salt intake. No extra salt. Whatever salt you take with your sabzi or your vegetables, that is good enough. So you do not take extra table salt because that is not good for your heart. Then sugar, also sugar intake, you should cut down on the sugar, especially so if you are a diabetic. Even then, for normal persons also, the carbohydrate quantity should be little down. So basically speaking, so in your diet, 1% should be protein, then 2% should be grains, and 3% say vegetables. So eat more vegetables and fruits. So if you ask me what is the safe way to the diet, then I'll tell you that eat more vegetables and more fruits, and avoid sweets or sweet things and fatty things and spicy things. So this is the thumb rule. So follow a simple diet and I'm sure you will be all right. Then you should never indulge in some habits, bad habits rather, like smoking, okay, because smoking can lead to not only heart disease but to many other problems like cancer and other diseases. So please, if you had this bad habit of smoking, you give it up immediately, whether before the operation or after the operation, whenever, like you are diagnosed with this disease, or please do not smoke. So smoking is not warranted, smoking is not advised. So please, you have to stop smoking. Regarding drinks, yes, you can take a little bit of drinks, but in very minor quantity. So maybe one pack or 2 packs are good enough, not more than that. I'm not telling you to take drinks, but persons whoever cannot do without drinks, they can take 1 or 2 packs once in a while, not that harmful. But smoking is not permissible. So you rather give up the smoking, and if you have this habit of taking drinks, you can take one pack or 2. No problem with that. That is even accepted by the American Heart Association also. If you can stop that also, it is good. But if you cannot stop, then you can do that. Then the third question I often get is when to take or when can I lift heavy weights, or say how much weight can I bear? So that is a very common question I usually get. And regarding weights, after a week or so, you can lift say 3 to 5 kilo of weight. So you can maybe lift a bucket of water and so. So gradually you can increase the weight. You can bear more weight, but you should start lifting weight only after say 4 to 6 weeks following the operation. And I have patients who have joined duties or joined back to the jobs after 6 weeks of operation. So it's like that. In fact, nowadays we research the patients on 5th day or 6th day, maximum 7 days if there is no other problem, and the patient can go back and join their duties by say 10th day or 15th day. Okay, so you should not sit idle. You should do a little bit of exercise